So let's get into to your story. It's very inspiring, very encouraging. So how about we start with undergrad and where did you go to school and kind of like, what was your major or what did you focus on for your education? We can start there.
That sounds great. And I'm what I like to call a late bloomer. I didn't go back to get my nursing degree until I was 28, 27. And I didn't become a CRA until I was 30. So I kind of really relate to people who kind of have to go to get from A to Z, you kind of have to go 18 different directions. Some of us do. And I'm definitely one of those people. My older brother is a surgeon, and I teasingly tell him he was born 40. He got his bachelor's, he got his master's, he got his MD, just perfect line, boom. Whereas I'll kind of segueing into my story. So I graduated high school. I went to junior college for about a year, and I didn't have my mindset in the right place. I'm a big advocate of if someone is smart enough and insightful enough at a young age to realize they need to experience some things, or they come back to the scholastic or career path, they're in an opportunity and a place too. I think it's really important. I did a lot of things before I went back to college to nursing school. I was a medical assistant. I worked in doctor's offices. I was a cardiology tech for a cardiologist. I mean, this is back when I was in my early 20s. And I amassed a ton of knowledge about like doing stress testing, doing EKGs. I was a phlebotomist and I worked at a hospital and I drew blood. And then I worked in the micro lab and I did plating, and I really had an opportunity to be exposed to so many different aspects of the medical field. And then I come from a medical family. My brother and my dad are surgeons. My mom's a nurse. Now, granted, my dad's retired, quote, retired. He still works part-time. Working 40 hours a week is retired for my dad. So anyway, that's another story. But I kind of was already in the lineup for medical. And I kind of had to do all these things before I kind of sat there and realized I want to work in the medical field. The final clincher to lead me to the clinical research and CRA role, even though I didn't even know about clinical research, was I was a flight attendant. The last year I had before I went back to college, and I was a flight attendant. And looking back, being a CRA and traveling for as many years as I did, it was the perfect marriage of my education and my nomadic nature. And I'll talk about that in a minute. But I did all these things, and then I realized my education was calling me. So I went back and I did an 18-month LVN, LPM nursing, licensed vocational nurse or licensed practical nurse. For California, it's licensed vocational nurse. I did it at a private nursing school, and it was so much better that I did it at that point because it tied in everything. I had a great training and background. I had the discipline being a flight attendant to be able to adhere to different schedules, getting up at the crack of dawn, et cetera, et cetera. So I was really ready at that point to just hit the ground running. And I graduated, and then I worked for a couple of years in private medical practices, just honing my skill set. And that's what led me to the funny story of how I fell into clinical research. And if you would like me to share that, because I think that would make it chuckle.
Please share.
I was looking for a challenge. I think probably like you, in the brief time I've spoken to you, you're very ambitious, which you have to be. And I've always been the same way. Like if I'm in one position, I'm always looking 3 steps ahead, which is mostly good, but not always good, right? Because you think you can do everything. And then later on, you're like, well, I can do almost everything. Quite everything. You have to have that attitude, but be a little balanced as much. So I went and applied for a position at a large health institution, Scripps Clinic in San Diego. I live in San Diego. And I was looking for another therapeutic area, maybe endocrinology, maybe pulmonology. I just wanted something new because I felt like once I went to school and got my nursing degree, I always felt like that kind of the bug to learn was always there, but it just bit and then it grew and grew. And I'm always constantly trying to find out things and learn things. And I think it's the researcher in me that didn't even realize until I came to clinical research how perfectly matched my personality and nature were for this career path.
Yeah.
So I walked into the Scripps Clinic in La Jolla. And I like to tell this story. I like to tell people that the recruiter saw something in me, but truthfully, she didn't. The recruiter saw somebody who had a heartbeat. And I say that jokingly, but it's the truth, because I walked in and it's the sentence that changed everything for me. The recruiter said to me, "Do you know anything about clinical research?" And Jasmine, you seem like you're quite a bit younger, but maybe this applies to you as well. More like 10 years ago, I've been in clinical research 21 years. It was a career that nobody knew about and that you fell into. And maybe you can relate to that. I mean, I literally have talked to so many people and I've written articles where 1 minute a person is doing something and then they turn the corner and this opportunity falls in their lap. And it's like, where was this wonderful career opportunity? And I'm not trying to digress, but I relate that to how I became a clinical research coordinator. I walked into Scripps Clinic in La Jolla, applied for a position for a nurse, and I walked out a coordinator, not knowing what a coordinator was or what I got myself into. And back to what the recruiter said to me, she said, the sentence that changed everything for me, she said, "Do you know anything about clinical research?" And probably if you could relate to this, to me, clinical research was Albert Einstein under a microscope, wild hair, white, white lab coat. And I thought, "Do I know anything about clinical research?" And I'm very transparent. And I said, "No, I don't."
Yeah.
I said, "Would you like to learn?" And you can relate to this. I can see it in your smile. And she said, "Would you like to learn?" And I said, "Absolutely, I would." And literally that day, normally you go in, you fill out an application, you wait for them to call you. If they even call you that day, I was taken to my PI's office. And I spoke to her, my PI, who was wonderful. And they asked me some questions, didn't care that I didn't have experience because they didn't want to have to untrain somebody. And I didn't know this until later. Also, I say, thank God for what I didn't know, because I didn't know that they had not had a coordinator in almost 6 weeks. And I literally...
That's a lifetime, right?
Exactly. And I literally walked into my first, so I was given the position, still not understanding what a transformative path it was on, not just my professional life, my personal life, because of the confidence and the focus and the inspiration we get from this industry. But I remember my first day on the job, I walked in and there were literally, this is back when there were paper case report forms. Do you remember that? The 3-part NCR where you pulled the copy off?
Mm-hmm.
Well, I literally walked into my new office and there were case report forms stacked high, regulatory binders on the floor. You're laughing, but I don't blame you for laughing. I was laughing too, but at the time I thought, I didn't even know what I didn't know. Because I had walked into a mess. And I was like hyperventilating, calling my mother. Oh, but my mom's like, just take a breath and keep it managed. I know, because right? My first week on the job, my PI, who's awesome, had scheduled a monitoring visit, and all the nurses in the clinic, all the nurses in the clinic were in a flurry, like, "Oh, that's so bad, that's so bad." Well, actually, the monitor had agreed to help train me. And that kind of ties into when I first realized what a cool role the monitor was and how much I want to do at the CRA. So after 3 panic attacks, almost quitting my job, after 3 months as a coordinator, I thought, okay, I feel okay about this. I don't lose sleep and go to bed at night with my heart pounding out of my chest, right? But it really taught me the importance of just, if you're going through fire, keep going. Don't give up. Even if you feel like you don't know what you're doing, if you do one little thing right, that's going to cascade to 2, 3, 4, and you're a senior CRA.
Yeah.
So probably about 3 or 4 months into my coordinator job, I thought, and this is what's so funny, I thought, I think I want to be a CRA, having no idea, right? But that's typically me. And so I talked to my monitors, and it doesn't seem like a long time for people who hear, but in that position, it took me a year to become a CRA. And in the big picture, that's really not a long time. But to me, super impatient, wanting to, I love being a coordinator, but I love to travel, and I felt the travel bug calling me. I saw these people who were training, mentoring, auditing. I loved looking at medical records. It spoke to my personality and my experience. But then I heard about the travel, And I thought, this is the perfect marriage of everything I love, right?
Right.
But it took me a year. And I literally I was assisted along the way by my monitors. And when you spoke to me about wanting to help people, it's so important and it's so sincere and it's so authentic because especially if you're helped, you want to pay it forward. So I was helped and I want to help people as well. So that's why I love what you're doing because it's so important. So that's how I became a CRA.
Wow. And then you said it took you a year, but a year is actually pretty good. That's, I mean, it's kind of fast, honestly, because nowadays you do have those people that they'll, go to undergrad and then they'll get a role right out. But that's, it's very rare, but they exist. But typically speaking, it's like at least 2 years on average now. So a year that's really good, especially with your, you coming out of nursing school and then coordinating for a year. Like that's really good.
I think back then it was easier. I think
That
now services like you offer are so important because it's more competitive. And that's why services like you offer and the other things out there are critical. And so that's another reason why I was so happy to be able to talk to you because what you're doing to help people is so important. And, I just feel very strongly about that. And I don't mean to dominate the conversation. Please ask me more questions
This is
because I could talk all day.
no, this is all about you and your journey, your story. So whatever you want to share, definitely share. But I agree. And not only is it harder now, it's getting harder every single year. I mean, there's people that you look at their resume, their CV, and they have this incredible background, experience, education, etc. And they can't get a single interview.
I know.
Single interview.
And that's heartbreaking. And I have people reach out to me quite a bit asking me, for advice and asking me, what do you advise? What can I do? And I can tell you that no matter how much harder it's gotten, there are some things that people can do that I applied that really will help.
Okay.
I worked really hard when I was a coordinator, not only because quality and working hard was important to me, and I'm a workaholic, I'll admit it, but I wanted to impress my monitors because they were the ticket for me to help get a position. Recruiting me directly is not good. And no one tried to coach me at all. It was all my own organic. What can I do? Is your company hiring, et cetera, right? And the monitor that helped me the most, I would be leaving Friday night and I would see her, or Friday evening, and I would see her in the cafeteria or the lobby getting a coffee. And she said to me, "Oh, are you leaving?" And I was like, well, and I kind of thought, okay, this is an opportunity to stay late. When I had my work done and she was, pulling the CRFs to put into the UPS container package to take to the UPS drop on a Friday evening for the interim analysis, I was helping her pull pages. I'm not saying anything like, wow, I did anything so unique, but I wanted to show how dedicated and focused I was. It wasn't just, oh, I think I want to be a CRA. And I was like, this is my goal. This is what I need to do to get to my goal. And then I did it because you follow through, successful people follow through. Follow through is more than half the battle.
It is.
So when I worked hard and I worked really hard, but I was given a lot of help. I will say that. But I think I earned the trust by my work habits. And then when I became a CRA, the monitor that helped me get my first monitoring job then became my first CRA manager.
Oh, wow.
So our paths were intertwined and it was meant to be. And I'm still friends with her 21 years later.
Wow.
And so anyway, so just to kind of illustrate what really made my journey successful from being a coordinator to a CRA, I talked about acronyms and our industry's full of acronyms. I like using the 4 Ps. It sounds very trite, but it's 100% true. Positivity, persistence, patience, and preparation.
Oh, nice.
And
That.
positivity sounds silly, but I'm telling you that in my career, enthusiasm, genuine enthusiasm and passion has gotten me farther than anything. Patience, because you have to play a long game. And even though I became CRA, probably to me, it seemed like a long time, but a year looking back probably is quick. I'll give you an example of what took a very, very long time for me. I've been a writer since I was 5 years old, and I've always loved to write. And I've always, when I discovered that I could combine my medical and clinical research background into my creative writing background and kind of merge the two. The best example was when I did a column for Centerwatch from 2012 to 2018. I wrote a column for Centerwatch called Pulse on Study Conduct. And it was about my adventures, my experiences on the road traveling as a monitor and neat situations I encountered. And I was able to combine creative writing with my story, with my clinical research background, and it was relatable, and it talked about things that I did right, things I did wrong, lessons learned, personal, right?
Mhm.
But to get to there wasn't an overnight thing. I remember back in 2007 or 8, I decided that I wanted to become published in clinical research. And because of my brain, good or bad, I thought, okay, I'll just write an article, submit it, and it'll get published. And it's like, how wrong was I? Because I was sending articles, writing samples to so many different entities, and all I got were crickets chirping. And that was probably a good 3 years. I mean, I maybe got one article published in 3 years of trying to get all these things done. I maybe got one article published. And finally, I was pretty relentless in sending my writing samples to the then editor of Centerwatch, who's a lovely person. She doesn't work there anymore, but she finally paid attention to me. I professionally stalked her. She paid attention to me. You want to be professional. You don't want to be, you want to be pushy and persistent, but you don't want to be like,
Yeah.
when the person sees it's you and says, okay, I don't want to talk to them. But it took a lot. And then I remember the first article I got published in ACRP Monitor, which is now the clinical researcher. I remember, and it's a humbling experience, but it teaches you the importance of persistence, being open-minded to criticism, constructive criticism, and realizing that when you think you know everything, take a step back because there are 8,000 people who know more than you. Mm-hmm. I remember the first article I had published in the Monitor, the clinical research or ACRP, it was a peer-reviewed article. I thought it was like the greatest article ever written in the history of mankind, right? Because I had written it. But then I submitted it and it got it didn't get skewered, but it got like ripped apart. Not ripped apart, rejected. It got highly edited. If you make these changes, you will get published. And I'm not kidding you. Like, I was so naive and silly because I was crushed. And my mother said to me, get over yourself. This is an awesome opportunity. So I got over myself and I did what they said. I became a better writer for it. And I was published by ACRP for the first time. And it really taught me, and it kind of is a global lesson about being open to learning and growing and how we can progress as clinical researchers and how coordinators can progress to CRAs and how foreign trained medical doctors can learn and open and grow and become CRAs. We all have something to learn, and ego has nothing to do with it. Mm-hmm. So it took me a very, very long time to get to where I've established nice relationships with a number of publications that if I write an article, I have a pretty decent chance of it getting published. But that took years. And frustration and humility and being open to people who are awesome editors and who know way more than I do about producing a product. And it was a really good lesson when I wrote the first book I ever wrote, which was called This Clinical Research Trials and Triumphs, a heartwarming novel found related to journey. Yeah. And that's the 5th copy that was ever sold. I'm just kidding. But what I'm trying to say is when I wrote that book, it's a dedication, and this is the truth. It's dedicated to the coordinators who were thrown in, and the clinical research professionals were thrown into this industry with no training, and who struggled and overcame and did it. People say the book is based on me, but it's not. It's inspired probably by 15 different people I know, myself, other coordinators who made the similar journey. But when I wrote that book, I thought, I'm so excited. It's going to sell so many copies. And it didn't sell so many copies. But that's okay, because it was such an awesome experience. I self-published it on Amazon. It was such a great experience, but it didn't sell a lot of copies. It did average to 4. It did okay. But the point is, it was part of the compilation of experiences of trying, succeeding here, failing there. But I did it. I wrote that book I wrote that book 6 or 7 years ago.
Oh, wow.
Oh, yeah.
And I was going to add that you said that it didn't sell 1 million copies. There's a lot of New York Times, the bestsellers, that when they first came out, they didn't sell anything. And then they kind of redid their marketing approach. And then the next thing you know, they had 1 million sales, 10 years later. So I always like to say it hasn't happened yet.
Absolutely.
I really feel like it's a fun read. First of all, it's a quick read, and then it's like a true representation of most people's experience, at least from what I've heard. My colleagues, people that I run into. I mean, we're all kind of thrown into it, right? Regardless of whether you're a coordinator, monitor, in regulatory, whatever your position is, it's like they hadn't got the training piece down, or maybe it's the think or swim approach. I don't know.
Not exactly. Who knows?
Yeah, who knows? But it's like that's how it is, right? And it's, survival of the fittest. If you make it, great, you can go on. But if you don't, you don't. Right?
I think you're absolutely right. And I think that, at the time you're kind of in this tunnel vision. This is what you're doing.
Yeah.
Big picture. And the big picture was writing that book, even though it did average, but it helped me garner wonderful opportunities to do book updates, like to the CRA's guide and PI's guide. I would have never had that opportunity had I not tried with my first feeble attempt at self-publishing. So it's like, and I trace that back to people who, you coach. I'm assuming you coach a lot of people in your business. You probably see a theme of people who, you really, really have to play the long game, because some people are going to get the job like this, and some people it's going to take 3-4 years. But you have to play the long game, because if you play the long game and if you are patient when you apply, you will get there. There's no if, you will. Exactly. But and then it will be everything you thought.
Exactly. And you'll be that much more prepared, right? I always tell all of my clients that are and so many people think within 3 to 6 months, they should be a CRA. And I have to give them the bad news. It might happen. It has happened for people, like you said. But, for a lot of people, most people, it doesn't. And you do have to play the long game. But like you said, you will get there as long as you don't quit. And it's worth it, right? It's worth it.
1,000%. It's worth it. The day I became a coordinator and then the day I became a CRA, I've never in my entire life, and my husband is wonderful because he puts up with it. I've never had such passion for something for so long that's never wavered. Some days I love what I do. Some days I've even in the worst day, I've never ever entertained leaving this industry. I probably would I don't know what I would do. I would probably have a meltdown, because I have known this industry for 21 years. I think about it too much. I love it so much. Even on my worst day, I'd never think of leaving. And it made me more goal oriented. It awoke a sleeping giant with work ethic, ambition. And this industry, people entering this industry, if you don't have passion, which 98% of the people I know do, you won't go forward. You can't be passive. And there are not passive clinical researchers, which is why so many people want to become CRAs or coordinators.
Yeah.
I mean, wouldn't you agree? People are passionate in this industry, especially with COVID. I mean, a year ago, March 13th is the day that everything kind of shut down, right? That's the last day I was on a plane. And I want to ask you, you're a senior CRA, correct?
Hmm.
And were you traveling a lot until a year ago?
I was. And like you said, at that date, everything stopped. Everything. And I actually haven't traveled since, honestly. I've been doing all remote visits because I'm an oncology senior CRA as well. And, with those patients, they're fairly sick. And most of my studies are phase 1 or 2. So they won't let any of us come on site at all. So everything has been remote.
I've been on site one time in the past 11 months. I was like you, I was traveling every week. Sometimes I'd be on site 2 days, sometimes 5 days. I also do remote visits. I also used to do remote visits here and there as part of my job. So kind of like you. Now everything's remote, video con.
Yep.
But even with that dramatic change, the passion is still there. It was hard. It's hard to change and get used to stuff. I mean, you have to be flexible with new and clinical research, but it's still hard because as a CRA, you could have your schedule booked, 6 weeks in advance, 2 months in advance. And so even though things can change, the certainty that your flights and your cities and your sites are going to stay the same is there. So having everything, like I remember I was scheduled to do a pre-study visit in Wisconsin. And on Friday, and I was in the hotel Thursday, and the coordinator wrote me and said, "This is March 12th. Can you do a remote call tomorrow?" And I called the project manager, and she's like, "Yeah." And so I did a remote call in the hotel room. And then I hopped the plane to go home, not knowing that would be my last flight for work. Because I traveled to a visit in August, but it was by train locally. So even the point I'm trying to make is even with this dramatic shift, the passion is still there. And our industry, it's almost like it's shifted back to more CRA jobs than CRAs to fill that. Crazy.
It is, right?
Yes.
I mean, it's so many people hiring, and it seems like I don't know. What do you think it is? Is it maybe COVID is kind of causing people to be more interested and more aware of research, perhaps? You
I
think?
think that's a very good point. I think that's it. I also think because of all there's so many COVID studies, I think that's another big thing. And I also think that there's more job opportunities with more remote monitoring jobs.
That's true. I see a lot of in-house positions and a lot of the larger CROs, even so, some of them already had in-house positions, but the ones that didn't, they've definitely developed this whole in-house department. So yeah, it's definitely changed the way we monitor. But we kind of, I guess, maybe about when did risk-based monitoring become a thing? Maybe about 4 or 5 years ago.
Yeah, I'd say 5 years ago. Yes.
Yeah. So we already had that kind of in the works, right? But now it's becoming even more so important with all of the remote monitoring going on, especially I don't know about you, but with my sites. So if they have EMR, it's not as big a deal, but a lot of people, they don't necessarily have an electronic ISF. So, of course, the sponsors, everybody's freaking out about how do we make sure they're, maintaining their regulatory documents, right? So that's been a big struggle on how to find a workaround for that piece. I don't know about for your site, but for mine, that seems to be kind of the biggest struggle is maintaining the ISF oversight.
I think, that is a big deal. I'm just amazed at how many sites are going electronic so quickly. Everyone's had to pivot and adapt. And you hear the vernacular pivot, adapt, and you part of you thinks, okay, that's a little cheesy, but it's not. It's very true because it's like we've all had to change. And then here we are. I was watching a silly TV show, it's a guilty pleasure called Below Deck. I don't know if you've ever heard of it.
Is it on Netflix?
It's on Bravo, and it's about the yachting industry. And
I know what you're talking about. I haven't. I saw a commercial about it, but I haven't watched it.
Well, it's a guilty pleasure. I'm almost embarrassed to say I enjoy it. My husband owns a marine lighting and electronics business, and he his degree in his externship in the Royal Navy in England. And he's very into boats and yachts and designing and electrical engineering and all that. And so we both enjoy it because he has this affinity. But the point is, they film about 8 or 10 months in advance. So the last episode we watched was right when COVID was hitting. And you've been in this groove for 11 months and you think, oh, the worry and the anxiety of it is gone. But then I'm watching this show and I see along the bottom of the TV, March 13th, they show the date when, and then the captain tells the people that his workers, the last two yachts are charters are canceled because of COVID. And it brought me back to like, it kind of brought me back a little bit to like, wow, like that was, I mean, do you remember? It was kind of scary. It was like, what's going to happen? Are we going to lose our jobs? Is my, what's going to happen? And then a year later, things aren't awesome, but things are good. And we have 2-3 vaccines, but it's just so funny how dramatically things changed and along the course we've adapted, but we still have like, you think back and you're like, Jasmine, 11 months ago, we were traveling on planes and gone almost all the time. Like, how weird.
It's so weird, right?
So weird.
It's weird. I thought it was weird to not be on a plane within like 3 weeks. And now I'm going into my second year. And it's like, it's so strange.
It's so weird. It's like this bizarro alternate universe and or this long bizarre dream, and we're gonna wake up and be back to the way it was. But I guess here we are, able to talk about your successful business and our wonderfully thriving industry with all these changes. Our industry and the CRA position and the coordinator's position sustain, like no matter what.
Yeah,
it's amazing. And it means what a wonderful career it is.
It is. It really is. It's one of the few industries that's actually still hiring. Like it didn't really impact it at all. There's, some of the smaller companies, it might have, kind of hit them a little bit harder. But for the most part, everybody, it seems like they revved up. They didn't lose anything. If anything, they gained clients and business. So it's amazing. That, like you said, it just speaks to how awesome a career and industry it really is.